So I know folks are still joining us, but I have turned off the waiting room. Good afternoon. Thank you so much for joining us for this HVCI session from Hunger Solutions New York. We're so grateful and thrilled to be joined by Misha Marvel, who's going to be presenting to us and answering some questions. My name is Maggie Dixon. I am the Home Visiting Coordination Initiative Development Coordinator at Prevent Child Abuse New York, and I organize our webinar series and line up speakers to come and talk to you. I am just going to give a couple housekeeping remarks. Closed captioning is offered for today's session. If you'd like to access these services, you can navigate to the bottom of your screen and there's a live transcript button down next to like the share screen control panel on the bottom. If you'd like to see transcript, you can click the arrow in the upper right-hand corner and select show subtitle. Additionally, just a friendly reminder to keep muted. Please feel free to use the chat box to ask questions or share comments. I see a couple people are introducing themselves. That's great. And we all will also be recording today's session as well. I have it recording right now. So after today's session, I will send an email out to all of the folks that registered with information about how to access the recording, how to get in contact with Misha, and any other supporting materials shared during today's session. So without further ado, I already introduced Misha, but again, we're so grateful and thrilled to be joined by Hunger Solutions New York, and thank you so much for joining us, Misha.
Thank you, Maggie. Hi, everybody. My name is Misha Marvel. I'm a child nutrition program specialist at Hunger Solutions New York, and I'm so grateful. Thank you to Maggie and Jen O'Connor as well to give me some time today to share with you some ways that we all can connect more of the families that we serve with the nutrition security programs that they're eligible for. So I'm going to toggle back and forth on advancing some slides. So Maggie promised me that she would holler if slides don't progress as they should. But for those of you who might not be familiar with us, I just want to introduce our organization. Hunger Solutions New York is a statewide nonprofit anti-hunger organization. We focus squarely on USDA's federal nutrition assistance programs, and we work to maximize participation among all who are eligible among all age groups. And I've listed these in the order in which we've worked on them. We were founded in 1985 and primarily worked on SNAP outreach through the Nutrition Outreach and Education Program, or we call NOAP. We added school breakfast and summer meals soon after. We started focusing on the Child and Adult Care Food Program, or CACFP, in 2015. And then we started working on WIC in 2018. And the way we go about our mission and much of our work is illustrated here, a combination of community-based services, statewide services, and administrative and legislative advocacy. And the elements might look a little different between programs, and the percentage of each element changes based on our funders' goals. But some concrete examples of the strategies that we use is we share information with families around SNAP, around WIC, around pandemic EBT most recently, and we encourage more schools or community-based organizations and childcare providers to participate in programs that fund healthy meals and snacks. And we advocate to strengthen and expand the reach of the programs, specifically through child nutrition reauthorization and the Farm Bill, which comes up supposedly every 5 years. And then most recently, the COVID-19 response. During our time this afternoon, I'm going to briefly touch on what we know about food insecurity during the pandemic. I'm going to spend the majority of our time talking about WIC and also share briefly some information and resources on other nutrition programs that the families that you serve could benefit from. And then we'll have some Q&A for as long as you'd like. I don't think I'll be able to monitor the chat box as I'm presenting, but Maggie says she will. And so please do, again, just type in those questions as we go along. And then we'll start from there at the end, if that's all right. So with regards to food insecurity during the pandemic, I'm not going to go into this slide in depth, but just want to level set us. that an estimated 1 in 5 of New York's children experienced food insecurity last year, and that more than 1 in 10 of overall New Yorkers experienced food insecurity before the pandemic. And we have some national numbers that tell us that Black and Hispanic households experience food insecurity at rates 3 times and twice the rate of white households. Thankfully, there were temporary policies put in place at the national level, and New York State took advantage of them as well, that prevented this food insecurity from being even worse during the pandemic. For example, all SNAP households are getting the maximum benefit amount for their household size, as well as additional emergency allotments. Pandemic EBT provides food benefits to basically reimburse school-age children's families from the food that they bought when school was remote during the height of the pandemic. For the past 2 years, school meals have been free for all students in most schools across New York State. And WIC boosted their monthly temporarily boosted the monthly benefit amount of vegetables and fruits. Previously, it was $9 per child and $11 per mom. And currently it's $24 per child and either $43 or $47 per mom per month, depending on whether the mom is pregnant or breastfeeding or not. And WIC also is allowed to provide remote services at this time for application assistance, as well as issuing benefits and nutrition counseling. And then flexibilities were allowed with often like in a grab and go service or grab and go situation, when some summer meal programming or summer enrichment activity programming, right, was suspended during COVID, as well as after school programs were suspended. I'm going to spend the bulk of our time today on WIC because of the important work that you do with families, with young families, and because we want to make sure that you know about the improvements to this public health service over the past few years. Some of you, I am well aware, might be experts in WIC and are really well-grounded in what I'm going to share over the next few slides, but I'm asking you to please don't tune out. And I'm sharing these things because community partners who are already working with eligible families have told us time and time again over the last few years that they didn't know lots of the things that I'm going to share with you right now. And so they didn't know that WIC was so underused. And we all need to do a better job of consistently and repeatedly sharing these benefits and the recent improvements in WIC, so that families really know what they're missing out on if they choose not to participate. And so in the next few minutes, I'm going to dig into these 4 talking point buckets a little, talking about how WIC is a public health service, the COVID-19 flexibilities, some modernizations that have happened for services, and the participation rate, just to give everybody a sense of what's happening in their area. And then, so really from a public health perspective, we all know that proper nutrition is vital at all phases of life, especially before birth and through a child's 5th birthday. Obesity in childhood can actually begin before a child is born. Gestational diabetes, excess maternal weight gain during pregnancy, and high birth weight can all increase a child's risk for becoming obese. WIC helps reduce these risks by promoting healthy eating and providing nutrition education for pregnant women and for children younger than 5. WIC's focus is improving access to fresh and nutritious foods in the communities where participants live, and participation in WIC is linked to overall better dietary quality and increased eating of fresh fruits and vegetables and eating less of added sugars. In general, WIC is a tremendous public health service. And in fact, a recent national report on the state of WIC shares that the return on investment for WIC is $2.84 for every $1 invested. And this is also why I'm highlighting WIC today, because even before the pandemic, many eligible people were not participating, especially families where English is not their primary language. early pregnancy, women in general who are pregnant, and families with toddlers and preschoolers. And we're really hoping that more community organizations will strengthen their partnerships with their local WIC clinics or WIC agencies, so to help ensure that more families, more kids and more families will benefit from WIC services. So next, I want to show you, for those of you who really like data, the coverage rate for WIC across the state in your area, for how, and then also how it's different among the various types and age groups. And I'm going to share this because the WIC agencies in your area know that WIC enrollment and participation has been declining for years, about a decade now. And we're kind of doing this lunch and learn in part in hope to help strengthen partnerships and referral systems to help turn those low numbers that you're about to see, to help turn those numbers around in your area. So in New York, WIC is administered, as we probably all know, but just in case, by the State Department of Health. And this is the coverage rate map for 2019, which was the most recent information that they could provide us. This was prepared by the State Department of Health WIC team. In counties that are shaded green, more than 50% of eligible households were participating in WIC. Yellow counties show a 41 to 50% participation rate. Orange is in 31 to 40%, and red is at the worst, at less than 30% of eligible households participating. So in 2019, the state estimated that WIC's coverage rate statewide was just over 50%. And we can see that nearly half of our counties, because of the colors, half of our counties had less than 40% participation. And really it was in the New York City area, which was above 50%, which kind of raised the statewide participation overall. And most recent participation data from the State Department has not seen a significant increase in new enrollment since the pandemic, which is different than what we saw. We saw increases in enrollment among SNAP and in Medicaid. So here's a map and I hope you can see the whole piece, but this is a coverage rate for infants, and you can see that there's lots of green going on. We have across the state, the highest participation rate are among infants, and WIC defines that as under 12 months of age. And so the participation rate is almost just shy of 80% participation. The next map is with women, whether or not they're pregnant or postpartum and breastfeeding, but women in general who are eligible to participate. And the overall participation rate is at 55%. And then the lowest participation rate among the age groups are among children, ages, specifically ages 2 to 4, right? So up until age 5. And so overall, and this is where you're going to see most reds and greens and yellows under 40% participation. Overall, the statewide average is just under 42% participation. So you really can see that we have some work to do to ensure that more families are connected with WIC, especially now that we know that the need has risen this past year or last 2 years. The participation rate, I will say, the participation rate among current participants has improved somewhat thanks to the remote services option, where people don't have to go into a local WIC clinic. They can have their nutrition counseling over the phone and their recertifications over the phone. And they can send in any documents that are needed. They can send those in electronically and they don't have to go. So we've seen increased participation and people not dropping out of the program as much as possible, but we haven't seen really an increase as we had hoped among newly enrolled, right? New enrollments. So I'm going to take a few minutes to share some information and some updates on some good news around WIC, if just to make sure that we all kind of level set on that. So, for example, as this little girl is so delighted about, participation has really never been easier because of the pandemic. Applications and services are offered remotely, and yes, you can get WIC from home. And just to make sure everybody is aware, right? who's eligible for WIC? Somebody can be eligible for WIC if they are pregnant. As soon as you find out that you're pregnant, you don't need a doctor, you don't need a pregnancy test, you just need to self-declare I'm pregnant. A mom of a baby that's up to 6 months old, a mom of a breastfeeding baby up to 12 months old, or the child under the age of 5. As soon as they turn 5 on their 5th birthday, then they currently age out of WIC. And then again, just want to repeat it, I'm going to keep this drumbeat. Pregnant women and children ages, especially 3 and 4, have the lowest participation and coverage rates among possible participants. And then also, simply, a mom or a child just must live in New York State and have income below a certain amount. It's 185% of poverty, or get benefits from SNAP or Medicaid or TANF, which makes them automatically eligible, but the fancy word for it is adjunctively eligible if you receive benefits from those programs. So in a person's unlike SNAP, a person's immigration status is never asked or considered. So a public charge rule does not apply. This has always been the case for WIC. You simply need to be living in New York State. Your immigration status has nothing to do with being eligible for WIC. And we also know that this has been a huge concern for some communities. And just to remind us all that an unborn child can be counted as a member of the household. So that's also a different from SNAP. So if you're pregnant, if you're pregnant and you have one child and a spouse, with SNAP, you're a family of 3 or a household of 3. With WIC, you can choose to be a household of 4. And so you can see that that would be a difference in your income level as well for the household size. So in fact, more families and more households could participate in WIC than in SNAP. And something that really isn't well known because of the name of the program really is that dads and grandparents and foster parents and caregivers can apply for WIC on behalf of the children in their care as well. So this slide shows a photo of an EWIC card on the left and the main screen of the New York State WIC to Go app on the right. And I share them because New York finished a 1-year-long statewide rollout of EWIC in the summer of 2019, and we're still hearing that people are not aware that WIC food benefits are no longer provided on paper checks. And really, I think this makes sense with the pandemic starting really kind of soon after EWIC started, and all of our attention turned to that. So if you're familiar with the WIC program from before a few years ago, this is just EWIC in the app are really good news for WIC families. You may know that in the past, WIC food benefits were received on a paper check, and a family had to buy everything on their food list all at one time. That's just not the case anymore. So EWIC card acts just like a debit card that a person swipes at the register, and families can shop when it works best for them. They can either go all at once for their monthly benefits, or they can go back to the store as many times as they need until all of their benefits are redeemed by the end of a 30-day, their own personal 30-day cycle. So, people can go and get their 1 gallon of milk just like everybody else does per week. You don't have to buy all 4 gallons at once. And again, due to the pandemic, many local WIC clinics are allowed to provide services remotely, whether it's over the phone or on video chat. And they're also able to load those EWIC cards remotely as well. So a family doesn't have to go into the office, including those benefits for those boosted fruit and vegetable benefits for somebody that can buy extra fruit and vegetables that they prefer. So this slide shows a photo of Wanda, who is the newest modernization for New York State WIC. Wanda is officially called a virtual assistant. Some people call her a chatbot. She's got a real reader-friendly and chatty tone, and she asks potential participants questions that pre-screen for WIC eligibility. In less than 3 minutes, Families can learn about WIC services. They can find out if they might be eligible, and then they can get referrals to WIC clinics near them. And if they choose, they can put in their information, and the local WIC clinic will reach back out to them. So this is a 24/7 service that families can use in the middle of the night. And then the next day, during business hours, then they'll get an email or a call back from the WIC agency to start that application process. So Wanda, she's super easy to use on a computer or a tablet or a phone. I will say that she's still in the pilot phase right now. And so she's only in English. New York State really hopes that they will be able to add more languages when that pilot phase is over next year. And so to make it really easy for partners, and I consider you a partner now, to help spread the word about Wanda, there's some graphics and sample social media posts linked on WIC Help New York's Resource Center. And here's a screenshot of part of that WIC Help New York landing page. When people visit, I don't think we have time to do a little tour, but when people visit the WIC Help NY website, they can find basic and reader-friendly information about WIC, and our website can be translated into 10 languages. So we include a state hotline phone number for Growing Up Healthy hotline. The State Department of Health administers this for a variety of services, including WIC. And we also include the link to the statewide list of WIC agencies. And of course, we have a link to Wanda. And we also link to a short video on how people can use their eWIC card at the store. And then in the resource center portion of the site, which is really focused to partners, there's just a number of different outreach pieces and fact sheets, including several in Spanish for partners use. And we'll be adding many more resources and additional languages for those outreach materials. So I just ask, please keep this resource center in mind with the families that you work with, and also sign up for our e-news, subscribe to our child nutrition e-news so that you'll get alerts when we add more resources to that site. And so to recap, New York State reaches about 50% of eligible New Yorkers. It's much less outside of New York City and among age groups other than infants. Specifically pregnant women and children ages 2 to 4, and children in the care of non-maternal caregivers are especially underserved. We have a variety of materials you're welcome to use to help spread the word on the wichelpny.org Resource Center. We're hoping and advocating that current fruit and vegetable boost that currently expires on September 30. So every month, families get that $24 or $43 or $47 per person benefit on top of their additional food package. That expires at September 30. We're hoping it's going to get extended by Congress or made permanent through child nutrition reauthorization. But if it doesn't get extended or made permanent, that benefit reverts back to the original $9 or $11 per child per mom per month. And so if you are in an agency that is allowed to do some advocacy or education with your elected officials, we would ask you to also sign up for our advocacy alerts, and we will be sharing some information for how to do some advocacy around that. And then all of us can either start or develop a partnership with local WIC clinics, and we're happy to help facilitate that connection. Again, that wichelpny.org website main page includes a link to local WIC clinics you can find in your area. So next, I'm going to just talk a little bit about some other food and nutrition security programs that your families might also be able to benefit from. First up is SNAP. SNAP is our country's largest anti-hunger program, and it helps mostly working families, senior citizens, and people with significant disabilities. We consider participation in SNAP as sort of a protective vaccine because there's a growing body of research that shows how SNAP can safeguard against food insecurity and improve health and academic and employment outcomes of growing children. And right now, again, due to the pandemic, all SNAP households are getting the maximum benefit amount for their household size. So now, USDA and New York State recognize that many people might not know that they're eligible for SNAP, or they may need some extra help applying. The application process is not simple. NOUP, the Nutrition Outreach and Education Program, is a nationally recognized SNAP outreach and education program, and it is in most counties in our state. Services are provided in the green counties here. Services are provided by local NOUP coordinators who are employed by community organizations, especially for counties that currently do not have NOUP services. Please know that the NOUP grant cycle is ending this June. It's every 4-year grant cycle, and we will be releasing the next slate of NOUP grantees later this spring. We're in the process of scoring, making those decisions now, actually. So, but for those of you who do have NOUP services in your area currently, we hope that you are already connected with your local NOUP coordinator, but just in case, I'm going to share a little bit about their services as well. So here's a list of what NOUP coordinators can do. Their services are always free and confidential, and they include pre-screening, helping applicants gather documents, fill out and submit an application. Many offer translation services or in-person in-home appointments as COVID allows, or meeting at a public location convenient for the person. NOUP coordinators work to make sure that applicants get the benefit that they're fully entitled to, not just the minimum. That would be pre-pandemic times. NOUP coordinators can present information and share more information to your agency's staff about SNAP benefits, and they can also, of course, and hopefully serve as a referral source for your families. We know that households that include grandchildren are almost 3 times as likely to be food insecure than other households. So in case your organization might be working with multi-generational households, I just want to make sure that you know that there's going to be a one-time cash payment for food assistance to SNAP and temporary assistance households, if or when those households include both an adult who is age 55 and older and a child who is age 17 and younger. And these households are going to receive a $730 per eligible older adult one-time payment. Those payments are going to be issued in a few weeks on April 23rd. To all those households on their EBT cash account. And the reason why I'm making sure that we all know this is that families must spend that cash within 90 days of receiving the payment, or the cash will be removed from the account. So it's basically, it's a spend it or lose it situation, right? And so if you work with families in multi-general households, just please encourage them to use their benefits before they expire. Summer. Here we are, spring just started, but summer. So I just want to make sure summer meals, right? So the summer food service program provides funding for local schools and community organizations to serve free and healthy meals to kids and teens over the summer break from school when they lose access to school meals. The vast majority of summer meal sites are what's considered open site, which means that they're open to all kids and teens in the community that come. Anybody under 18 can drop by for a meal at no cost. There's no application process. There's no paperwork. There's no income requirements for families. That's all been taken care of because of the community, the community income level. Summer meals reduces summertime childhood hunger. It mitigates learning loss. Kids are ready to go back to school in the fall. But many kids don't have access to summer meals. Even before the pandemic, only 1 in 4 low-income kids in New York ate a summer lunch on an average summer day. And so there's really a variety of meaningful ways to help grow summer meals. If you're from an organization or program that might be able to serve summer meals, or if you can help recruit sites in your community, you can find more information about eligibility and everything else really on summermealsny.org website. You're also welcome to reach out to us to talk one-on-one. My colleague, Krista Hesdorfer, would be happy to talk to you. And if you're able and eligible to operate a site, the next step is to contact a local sponsor that is already operating summer meals in your community. We have a summer meals sponsor directory linked on this slide and on our website that you can find your sponsor easily. And And another meaningful way is to help with outreach to families. In a recent USDA survey, the top reported reason families did not access a summer meal site in their community is that they simply didn't know about it. We know that you're trusted messengers. If you could just share information about local sites, using a variety of resources. And if you've done it before, thank you. We do want to let you know that the Summer Meals texting hotline has been changed for this summer. It's going to be 304-304. It used to be 877-877. And currently that number, if you use that number, 877-877, it's going to redirect families to the new hotline, but we're just working to update and get the word out about 304-304. So in the interest of time, I'm really not going to touch on the next few slides, other than to remind us all that nearly all public schools in New York offered free meals to all kids the last 2 years during the pandemic. And without congressional action, those waivers are going to expire this June 30. If that happens, there's still a way schools can offer free meals to all through the community eligibility provision, but it's important for families to submit those school meal applications or to receive SNAP. Excuse me. So if you're working, we are working to maximize school meals programs, and I've included this slide for you to reference later, or share with your colleagues who can work with us on this really important issue. And then CACFP is another underserved child nutrition program where less than 50% of childcare providers participate and get reimbursement for the healthy meals and snacks that they serve to children in their care. And we have some resources on our website, as well as, of course, to help more programs participate in CACFP. So I've gone over a lot of different resources for you, and I just want to quickly recap, and then the links are embedded in the slides that we'll send out. So you might be wondering, what can I do? It's really simple. We just really ask that you consider connecting with the resources that can easily help your community, and share even just a little bit of what you learned today, whether it's with your colleagues, the families that you serve, somebody else in your agency, and encourage for them to connect to these programs as well. Everybody on this call knows that people may need to hear and see and read things multiple times from multiple trusted messengers before they reach out. And I know that you could be that trusted messenger for the families and the communities that you serve. And so I wanted to make sure I included all of the websites that we manage. They all have a variety of outreach materials tailored to the appropriate audience, whether it's to families or to schools or providers and potential sponsors. And then thank you again, Maggie, for letting me share this background information, and for everyone here today or listening later as it's being recorded, really, truly, for all that you do to support your community. We are very much looking forward to working with you all, and hope that you just consider us as partners in your work. And of course, you can always connect with us directly. I encourage you to sign up for our email alerts when we send out when there's policy or program updates or outreach opportunities or advocacy needs. And we are also very active on Facebook and Twitter and Instagram with resources that you can easily flip and reshare on your channels. And then, of course, the slide deck is being recorded, and in that you'll get the slide deck and have the links embedded in there as well. So with that, I'm over a little bit of time, but I would be happy to stay on as long as there are some questions in the chat, or if people want to unmute yourself. And if I don't have an answer, I can get it for you later.
Absolutely. Thank you so very much, Misha. It was incredible information and very important. I know I'll be signing up for the e-alerts.
Yay!
And I'll be certain, in addition to including the slides, I'm happy to just put a Cliff Notes version of some really good, helpful, quick links, like to Wanda, to wichelp.newyork.org. Everybody on this call plays a crucial role in distilling down this information and information about the deadlines and everything, and communicating it to support families and children. We have a couple questions in the chat, and I encourage folks to keep chatting me. You can private message me or send it to the group. The first question, Misha, here is, can parents use a WIC card in the self-checkout line, which might help reduce stigma?
Yeah, there are some stores, and that's increasingly, that is possible in some stores, in some chains. I can get the list of those to Maggie and include those in the materials afterwards. Let me write myself a note about that. But not all stores yet are capable. I understand that the goal is to get more of them to be able to do so. And really there was there's a technology piece involved to get everybody up to that. But more are involved with that self-checkout. But, part of the beauty of the way, even in a regular line, so in the past, a person needed to put all of their WIC foods on the conveyor belt separately and get that transaction done. And then all of the other things and other items and other things that we all buy at the grocery store, whether it's a food item or not, needed to be like a completely separate transaction, completely different on the conveyor belt. Well, so that's not the way it is anymore either. So a person can put all of their food, all of their items in their cart, regardless of what it is, on the conveyor belt at the exact same time, just like everybody else. And then we just want to remind people to swipe your eWIC card first, and then the computer will automatically remove or redeem those benefits from that were eligible. And then, so you swipe your eWIC card first, and then you swipe your other sort of payment, whether that's SNAP benefits, whether that's your personal debit card or credit card, or paying in cash. So so the process really isn't stigmatizing anymore, because it's just simply a swipe and then a separate swipe. It takes 3 seconds.
That's great. And I'm happy to, please send me the list, and I'm happy to include that. But it's good that there's an effort, being made to kind of improve accessibility, whether it be in the checkout line or the self-checkout.
Yeah. I'm not sure whether the pandemic slowed down the process for getting more self-serve stores online for this or not. I have no idea, but I know it's I know there is a number who are allowed now, and that more could be coming.
That's great. One question about referencing the charts you showed about folks who are eligible and currently taking advantage of WIC programming. Is there a distinction being made about not reaching eligible people versus keeping people in the program for an entire eligibility period? So this.
Yeah, so it's kind of like a we can well, maybe, I mean, I'm not quite. Did you get to finish the question?
It just says, it looks like infants get the best coverage, and then it drops for older kids.
Yeah. So so there's a whole lot of work in within the healthcare community, and it's most common, it seems, that when a child is born in the hospital, that might be the time that a family learns about WIC. And so that there's connections with that healthcare provider and the WIC agency. And so, and for families that need to use, even though WIC highlights and strongly supports breastfeeding support, for families that need to use formula, it's very expensive. And so WIC helps with that a lot. And when a child ages out of and becomes more of a toddler, there's some paperwork involved to recertify. We're also doing advocacy to extend the certification period to 2 years instead of 1, to help prevent some families from dropping out, even though they're still eligible.
And so another question in the chat here, and I actually had jotted down something very similar. Can you talk a little bit about, why participation is so low despite eligibility? People are saying, what are the biggest barriers? And I had noticed, I love that you said participation had increased with the advent of virtual services, and Wanda, and coinciding with education. I think a lot of it is education as well. But can you talk about that stigma and why, is there such a barrier for eligible families taking advantage?
Yeah, so I think some of the increases, so for people who receive SNAP went from what used to be literally food stamps in the food stamp program and paper food stamp packages and had a high stigma, they went to the EBT debit cards experience over a decade ago, right? And WIC across the country, not just New York State, but across the country, kind of was able to be brought up into the 21st century with how we all shop, right? And to help reduce that stigma just a couple years ago. So the shopping experience is one issue, a well-known issue that's being addressed, that has been addressed, that's being addressed. But now we need to have, so if you think about it, if I had a baby or my sister had a baby 4 years ago, and we were on WIC, or she was on WIC 4 years ago, they had that experience of the paper coupons. And so, 4 years later, you have another baby, very common for all of us, right, to have within that window. And so you might not be aware, or you might say to yourself, I don't want to have that same experience in the shopping in the store anymore, right? That app in the store also makes the shopping experience much better, where a person in the aisle, in the food aisle that they're in, they can scan a food item and make sure that the item that they're looking at is WIC eligible for them before they even take it up to the conveyor belt, to the checkout line. And so that prevents a potential hassle at the checkout line as well. Another issue that's well known is transportation. So that's one of the reasons why we see increased participation among current participants now, because of the remote services. So transportation is a real issue. In some counties, there's only one WIC agency with a few different clinic sites, and driving across county can be a real, and in areas whether or not there's adequate transportation, gas is an issue.
Right.
Getting all of your kids, not all of your kids, getting your whole, whoever needs to have that appointment, transporting them across the county is a thing. So remote services are something that we are advocating for, and the WIC agencies themselves are advocating for, to continue doing, where there's a combination of, instead of having to go into the WIC clinic 4 times a year, maybe you need to come in twice a year for some of the appointments, to help make it easier for families, or aligning everyone's appointments at the same time, so that you only need to come in once for your whole family, as opposed to separate times for separate family members, that sort of thing. I would say recently, the scare in a lot of communities around public charge and immigrant communities, where you had eligible WIC families not wanting to participate because they were afraid that it would impact their immigration status.
Let's see if there's any more questions. So folks are sharing that, and maybe this is just a technical, I'm not sure. How old is the app, Misha? Is it relatively new?
Yes.
Okay, yeah. So folks are sharing like they've had some trouble with the app will say that it's an eligible WIC item, but then they go to check out and it's not actually eligible, which might just be a back end issue in terms of the app between the store. I mean, I'm sure ideally, we'll get to a point where those things are worked out over time, but that's a shame that folks are having that experience.
So if that happens, if that happens, there's an opportunity and a way to contact and kind of report it, so that glitch can get fixed on the back end for sure. But if those pieces, it's the kind of thing like, so for example, the electricity in my neighborhood literally has been going wonky in and out, and there are trucks in my neighborhood. And we get this thing where like, you have to self-report a power outage to let Niagara Mohawk, which is our service provider, know that we are out of power. And so it's kind of like this, I kind of see it as the same thing, right? If WIC didn't, if the app or the who do they call it? The programmers aren't aware that there's a glitch, we have to self-report that there's a problem here. So then they can't fix it. So, but everybody's able to report problems with their EWIC card. or with the app.
So I don't see any more questions in the chat right now, but I invite folks, to have some space to unmute and ask questions now.
I am curious. I could ask if I could ask everybody if there's anything among any. Was there anything that I shared that you were kind of surprised about, or that you like didn't know before, or did I seriously share information that everybody knew already? Which I hope is not the case, but.
I can say that I learned a lot in terms of the nuances of eligibility, the differences between WIC and SNAP. Just waiting for some thoughts in the chat. And while folks are sharing, Misha, I hope you don't mind. I actually have a little bit of a question, but my other hat at Picani is a policy assistant, and when you shared the expiry of school of the free meals on June 30th, is there anything that we can help to do to support? Maybe we can talk offline about that.
Yes, yes. So we do have a number of ways for organizations that are able to do some legislative education or advocacy. And so if you aren't already signed up for or subscribed to our advocacy alerts or the Child Nutrition e-news, please go ahead and do that. We also post some things on social media channels, so to follow those. And then we were really, among all child nutrition advocates, really disappointed that Congress did not take an extension to school meals for the next school year. So it's not dead in the water, but it's not looking good right now. And so continued pressure and the sharing this, literally, if you can't advocate, what you can do is you can share stories and share information from families with Maggie or with me. And we can use those stories of what the impacts from real families and share those with legislators who voted against extending the school meals.
Absolutely. A couple people sharing, thank you very much, Heather and Margot, sharing they didn't know school lunch was free for everybody, did not know about NOEP, did not know about summer meals or the texting hotline.
Okay.
I had no knowledge of NOEP either, and that's just partially probably because there's so much information out there. But so yeah, sounds like
that, fabulous. So the food help, the NOEP, the foodhelpny.org website, you can very easily, that map, there's a mapper on the website. You just type in your county or your zip code and you'll get the real NOEP coordinator, the real person's name, their email, their phone number, the person in your area. And then you can partner with them.
That's great.
And they'll pre-screen your families for SNAP and help them with the SNAP application.
That's great.
So, and anybody who gets SNAP, like I said, if you've got a multi-generational family and you are receiving SNAP in April, then there's that $730 additional one-time allotment to those multi-generational families. So if you're working with any grandparents raising grandkids, let's get those applications in now so that they can get that extra benefit too.
Yeah, when I heard that, I was like, that's wonderful.
Yeah.
The cash assistance as well. I think just making sure we're educating about using the funds and this is, when you said that this is a spend it or lose it, I was like, okay, so the importance of the role of family support, and social services work, like just making sure we get that information out there.
That's right. It was the same way with the pandemic EBT, for families that have kids who are school age kids, they automatically got those benefits. And some people who, if they already received SNAP, those extra pandemic EBT benefits, which were hundreds of dollars for families. I don't remember the exact dollar amount off the top of my head, but they automatically came on a person's EBT card. And it's the same situation. If you don't, thankfully with that, they have 1 year to spend them. But if they were not receiving SNAP already or Medicaid already, and they got that pandemic EBT because they receive free or reduced price school meals normally through school. They got a card in the mail. And we heard so many stories of families that they're like, they think it's a scam. They don't know what to do with it. Do I throw this away? Do I use it? You know, that sort of thing. And we're like, oh my goodness, it's hundreds of dollars, right? So it's about getting the word out that yes, this is legit. Yes, you should use it. You know, yes, this is for you. No, it will not impact your immigration status. You know, this is for you. So it's kind of like, you know, some people are like, well, why do we have to do outreach for this if it's an automatic issuance, right? And it's because we don't want people to let these benefits go to waste.
Yeah, absolutely. Misha, just a lot of gratitude in the chat. Didn't know about, you know, scanning items and apps, which I think is just a testament to the new day and age that we're in, where literally everything is now an app or virtual, from our parking meters to everything. But, you know, folks sharing, they've taken a lot of notes, you know, wishing that eligibility and requirements for enrollment were a little bit more standard across the board, the same level for programs, but you know, sharing that this individual sharing that they have WIC and Medicaid, but am denied SNAP because of the guidelines are different. So it's like, it's just confusing. So kind of the role that we play to keep all of that straight and in line, so then we can relay that to families. But folks just sharing that they've learned a lot. So
good. I am curious if anybody had anybody heard of Wanda before? That 3-minute pre-screener for WIC. And while people were,
oh, I'm sorry, I was just going to say thank you, Heather, by the way, for sharing that as well, because it's important for it's important to know kind of about those nuances.
Yeah,
I hadn't heard of Wanda, Misha, until I received an email, I think forwarded from Jen. Yep, see, people are saying they haven't heard of it.
okay, great. Yep. So she's great. Like I said, she's only in English right now, but in the slides are on our website, wichelpny.org. You can, you know, there's a link to Wanda right there, and you can use it if you want to test it out a little bit, whether or not you're eligible. Current WIC participants can use it and get additional information if they've got questions about their account. But it's primarily for, it is primarily to help pre-screen people very quickly and simply, and then to be a warm referral, right? So you're not sending people off and go and say, here, go contact this WIC agency. It's like, you know, do you give permission for a local WIC agency to call you or to email you, right? And then they're in, because the WIC agencies want to help serve all the, you know, the people in their community. And because you don't necessarily, you know, you don't need to go in physically present to a WIC clinic now. Now is also a great time. You know, it's super convenient to participate in WIC.
Right. And as discussion was saying in the chat, the, you know, the confusion sometimes associated with, you know, am I eligible? Is this for me? And not wanting to walk in and be wrong or have to ask questions like that. So it's kind of removing that barrier.
To go back to the person who was frustrated with the income guidelines not being the same among all programs, I'm with you and I hear you on that. But I will say, if families who have any dependent care costs, which is the fancy word for saying childcare costs, those can be deducted from your, you can be eligible up to 200% of poverty, as opposed to the traditional 135. And so, like I said, that NOAP coordinator, even if the family is already receiving SNAP benefits, officially, NOAP coordinators can help make sure, you know, they would do it mostly for new applicants to make sure that you are receiving all of the benefits that you're entitled to. But it can also, you know, when it's time to recertify, can help make sure that you're receiving all the benefits that you're eligible for, which means using all the deductions that are allowed. I don't know if that actually confused things more.
I mean, I'm income eligible, like eligibility, based on income and the federal poverty level is tricky, because I feel like the numbers are all different, especially once, like when the executive budget just came out and now they're shifting, eligibility for childcare subsidies, and it's from like 200%.
Oh yeah, and I don't even know about those
And
at
I'm
all.
like,
Right.
yeah, and I'm
Yeah.
like, okay, well, I can't keep it straight. So,
Yeah. The nutrition programs are usually at 185.
okay, that's good to know. And so you said 185, and I thought I heard 135 for, oh no, it was 185. Okay. So please, continue to write in questions, but I will be sure to include a copy of these slides, a couple quick links that folks don't have to, dig through the slides in terms of accessing WANDA, Hunger Solutions website, and the WIC help.newyork.ny.org, just for some quick information. Thank you very much for joining us. I hope that this was helpful. The chat is certainly indicating that it was. And Misha, I'm happy to share your contact information to folks. Once they watch the recording, if they have follow-up questions, I'm sure they can contact you and ask accordingly. But thank you so much for joining us. And I can turn it over to you for any last minute closing remarks, or folks are just saying thank you in the chat.
Yeah, no, and I thank you. And I actually wanted to check if I could before, because I'm not able to see the chat the way I've got my screen sharing, if I can capture and copy all of the chat so I can follow up accordingly as well. Or if you can do that for me, Maggie, I'd really appreciate that.
Absolutely.
Yeah, so mostly I just want to encourage everybody to, please don't hesitate to reach out. Our mission is to maximize participation in these programs and to protect the integrity of them and to maximize participation in them. So if there's anything that we can do to, if there are resources that you need that you're not seeing that we have available to you, please let me know, and I'll, raise that up with our communications team to in their queue. If there's stories that you can share from the families that you serve around these programs, whether they're the good, the bad, and the ugly, right? So we would very much value those and would be able to use those in advocacy efforts to protect and strengthen the programs. Yeah, and we just hope, like, y'all are doing such amazing work. My background was in home visiting and child protective services way back when, in a different state. And the work that we do is really, really important with families. I would just thank you from the bottom of my heart for the work that you do. So please just consider us a partner in helping you serve your families.
Thank you very much, Misha. Thank you everyone for attending, using your lunch hour, and I will be in touch with follow-up information. Thank you again, Misha. I hope everybody has a great day.
Thanks.
Thanks. Bye-bye.